Let's talk about acne. It can be so frustrating, right? And it really feels like you're just trying to figure it all out on your own. But what if there was a professional playbook that you could actually follow? Well, that's what we're going to do. We're going to dive into this because today we're taking a clinical guideline and turning it into your personal action plan for managing acne. And we're going to do it with a key player you might be overlooking, your pharmacist.
First things first, and this is the most important point. This is not just about your skin. Let's be real. If you've ever felt self-conscious or just down because of a breakout, you are not alone. The official guidelines acknowledge this right from the start. That emotional impact, it is very real, and it's a huge reason why getting effective treatment matters so much.
Okay, so knowing the toll it can take, what's the actual plan? You know, the structured approach that the pros use. How do you go from feeling totally lost in that skincare aisle to having a clear, personalized plan that actually works for you? That's exactly what we're about to break down.
Now, let's just clear up a common myth right away. Acne is not just a teenage problem. Not at all. It affects tons of adults, especially women. And listen, here's probably the most critical takeaway from the playbook. Treating acne early, even when it just seems mild, is the #1 way to prevent two things nobody wants: permanent physical scars and that lasting hit to your emotional well-being.
Think of your pharmacist as an amazing resource, an incredible first line of defense. But they're also trained to know when it's time to bring in a doctor. So the very first step in any good playbook is knowing when you need to make that call.
So what's really cool here is how we can turn these clinical criteria into a simple checklist for yourself. Just take a second and ask yourself these questions. Is your acne severe, or is it leaving scars? Is there a family history of scarring? Are there any other health things going on, like maybe a hormonal issue? And this is a big one. Is it really affecting your quality of life, your confidence?
And the guidance on this is crystal clear. If you answered yes to any of those questions, your best move is to book an appointment with your doctor. That just ensures you get the right diagnosis and can access the full range of treatments from the get-go. For everyone else, the pharmacy is your next stop.
So what really happens when you talk to a pharmacist about your acne? I promise it's not just a quick transaction where you grab something off the shelf. It's a proper consultation. You can think of it like a strategy session where they gather all the intel they need to build your custom plan. Let's look at what they're going to cover.
First up, they're going to look at the big picture of your health. This is a super important safety check. They're making sure that any recommendation they give is absolutely safe for you, that it won't clash with any other medications, and that it works with your unique health profile. It's like building a safe foundation before you even think about putting up the walls.
Next, they basically become a detective for your skin. When did the breakouts start? Where are they on your body? What have you already tried? Did anything work, even a little bit? See, the more details you can give them about your personal acne story, the better they can tailor a solution just for you.
And finally, they'll zoom out to look at the even bigger picture. This means your daily skincare routine, any potential triggers from your job or your environment, and, really importantly, how it's making you feel. This is a holistic assessment because, let's face it, acne isn't just a clinical issue, it's a deeply personal one.
All right, so with all that information gathered, now it's time to actually build your plan. And this is not going to be some one-size-fits-all solution. Nope. It's a personalized strategy based on everything you just talked about, and it usually follows a really clear two-path approach. So your plan is going to have two parts that run at the same time. On one side, you've got all the lifestyle and skincare advice, the non-medicated stuff. On the other side, you've got the actual medicated treatments. And what we know is that the most effective plans always combine both of these for the best results. You got to attack it from both angles.
Okay, let's look at the medicated treatments. Think of it like a ladder. You'll probably start on that first rung with over-the-counter products, stuff with ingredients like benzoyl peroxide. If that's not quite enough, a pharmacist can help you move up to the next level, maybe topical retinoids, which are amazing for unblocking pores. Then you might add topical antibiotics to fight inflammation. And for more widespread acne, a doctor might prescribe oral antibiotics. The key is that it's a step-by-step process. Of course, the strongest options, like isotretinoin, always come from a doctor.
Now, when it comes to antibiotics, there is a golden rule. Whether you take them orally or put them on your skin, they are not a long-term solution. For oral antibiotics, the playbook sets a really clear limit, 3 to 6 months max. This is so important for preventing antibiotic resistance.
And that exact same principle applies to topical antibiotics too.
For something common like clindamycin, it's typically limited to about 3 months. The goal is always to use these powerful tools strategically, for a short burst, not just indefinitely.
Okay, having a plan is one thing, but making it actually work is a whole other ballgame. This next part is all about execution, and honestly, patience. Your role in this playbook is just as important as the pharmacist's.
Now listen up, because this might be the single most important piece of information in this entire explainer. So many treatments fail simply because people don't stick with them. You have to give it time. The guidelines are super clear. It takes between 6 and 12 weeks of consistent, everyday use to really start seeing a visible difference. So please don't give up after just 2 weeks.
And remember, you're not in this alone. This is a partnership. Your journey doesn't just end when you walk out of the pharmacy. The playbook is designed with follow-ups. A check-in around the 6-week mark is pretty standard, just to see how things are going. And from there, your reviews will be personalized to make sure you're staying on the right track.
So there you have it, the professional playbook for acne, completely demystified. You now have the steps to go from feeling lost and frustrated to feeling in control. The path to managing your acne is so much clearer than you might think. So the only question left is, what's your next move gonna be?